Hey guys, today's Reinhardt's Rundown is focused on what to do when your patient is on nicotine patches for tobacco or smoking cessation, but might be experiencing breakthrough cravings. Now, nicotine withdrawal symptoms are worst in the first week, particularly around day 3, and can be pretty significant for a month or so after the quit date. Obviously, most of us are familiar with those symptoms: irritability, mood changes, including sadness or depression even. We see difficulty concentrating, restlessness. Patients can have insomnia, anxiety, increased appetite, headache, overall fatigue, and brain fogginess as well. Aside from the physical withdrawal symptoms, breakthrough cravings can last for up to 6 months. For our patients on nicotine patches, sometimes they'll try to manage these breakthrough cravings and will maybe want to use 2 patches or, even cut a patch and add another 1/2 of a patch to their current dose. Using 2 patches can increase the risk of toxicities. The patch is slowly releasing over time, so adding a second patch will not bring that acute relief of the craving. Also, cutting a patch can affect the absorption of nicotine through that transdermal system. Now, there are multiple different kinds of transdermal patches: matrix patches, reservoir patches, drug and adhesive style, and the type of patch used by nicotine replacement brands are not always consistent. So cutting a patch can result in too much nicotine or too little nicotine. So if we have breakthrough cravings while on the patch, we want to add in the gum or the lozenge for a periodic use throughout the day. This keeps the stable, constant nicotine concentration, but also allows for relief from those acute breakthrough cravings. This approach of using the patch plus the gum or another oral form has been much more effective when we talk about successful quit rates with NRT. The use of 2 different therapies is more expensive, of course, but quit rates can be improved by 50% or more and is definitely the route that we want to advise them to go. Hopefully today's video was helpful. We'll see you in our next Reinhardt's Rundown.